Today we're going to walk through a single, really powerful clinical case. It's a story that pulls back the curtain on the incredible, complex journey of fighting advanced oral cancer, from the patient's first visit to the high-stakes decisions and the amazing medical strategy designed to win this fight.
So, where does it all begin? Well, it starts with the patient's own words. We have an elderly man who walks into a clinic with a problem that's just been getting worse and worse for months. And we're not talking about a simple canker sore here. This is a growth that has just relentlessly taken over his life, making it hard to eat, hard to talk, hard to just be normal. These are the devastating classic signs of an advanced oral cancer.
The medical team starts digging into his history and, bam, there it is, a crucial clue. For 20 years, this patient used gutka, which is a really potent form of chewing tobacco, holding it right there in his cheek. Now, this is no coincidence. Gutka is packed with carcinogens, and it's a known direct cause of the very type of cancer they're suspecting here. Okay, so with that history, the medical team knows what they're likely up against. But now comes the first critical task. They have to stage the cancer. They need to figure out just how big this enemy is and map out its territory before they can even think about coming up with a battle plan.
This is the one question that drives everything that comes next. How serious is this, really? And getting an answer isn't about just one test. It's about building a complete three-dimensional picture of the cancer. How big it is, where exactly it is, and the most important part, has it started to spread?
So how do they do that? Well, they have a very methodical three-step pathway. First, a hands-on clinical exam, a really thorough look at the mouth and neck. Then they do what's called a punch biopsy, where they take a tiny piece of the tissue to look at under a microscope. And finally, a CT scan, which gives them this incredibly detailed 3D map of the whole area, head, neck, and chest, to see the full extent of the disease.
And the biopsy results, they confirm the team's worst fears. It is squamous cell carcinoma. But the pathologist also adds another detail. It's moderately differentiated. Now, what does that mean? Well, in simple terms, it means these cancer cells have changed a lot from normal cells. They're more chaotic, more unpredictable, and that's a huge red flag for aggressive behavior.
So this right here, this is the battlefield map. It's called the TNM system. Let's break it down. T is for the tumor. T4A means it's big, and it has already invaded deep into the jawbone and muscles. N is for lymph nodes. N2B means the cancer has escaped the primary tumor and set up camp in a single large lymph node. And M is for metastasis. M0, that's the one piece of good news here. It means there's no evidence it has spread to distant organs like the lungs. You put all that together, and you get stage IVA, a locally advanced, very, very serious disease.
You just don't fight stage IVA cancer by yourself. A battle this big requires what's called a multidisciplinary team. We're talking surgeons, oncologists, radiologists, pathologists, speech therapists, everyone bringing their A game to the table to hammer out a single, unified strategy.
And the team's decision is unanimous. They need to be aggressive. It's going to be a two-pronged attack. First, a massive surgery to remove every last visible trace of the cancer. Then, once the patient has recovered a bit, they'll follow up with a combination of chemotherapy and radiation to hunt down and destroy any microscopic cancer cells that might be left hiding.
Now we get to the operation itself. And honestly, this isn't just a procedure, it's a marathon. It combines three incredibly complex and coordinated surgeries all in one go. It's a pretty amazing feat of both aggressive cancer removal and really intricate rebuilding. Phase 1 is the direct assault. The surgeons perform a wide local excision. This means they remove the entire cancerous mass from the cheek and the part of the jawbone it has grown into. And they have to take a clear margin of healthy tissue all around it, just to be absolutely sure they've gotten it all. Okay, once the main tumor is out, the focus immediately shifts to the neck. The cancer has already spread to at least one lymph node, right? So to stop it from spreading any further through the body's lymphatic highway, they perform this incredibly meticulous dissection, systematically removing all the lymph nodes in that area.
And this part, this is where modern surgery just feels like science fiction. Think about it. A huge chunk of the patient's jaw is gone. It has to be rebuilt. So while one team is working on the head and neck, a second surgical team is simultaneously harvesting a piece of bone from the patient's lower leg, the fibula, along with its own dedicated artery and vein. So what is this free flap? It's basically a living piece of your own body, completely detached and then transplanted somewhere else. In this case, that piece of leg bone is carefully shaped into a new jaw and secured with tiny titanium plates. Then,
And this is the amazing part. Surgeons, using a microscope, painstakingly connect the tiny artery and vein from that flap to blood vessels in the neck. It's like microscopic plumbing. And once that connection is made, blood flows in and the new jaw comes to life.
But the battle isn't over when the patient leaves the OR. Not even close. The period right after the surgery is the next critical phase, and it comes with its own set of huge risks that require around-the-clock, constant vigilance.
For the first 72 hours, that new flap is the center of the universe. It's checked every single hour for color, for temperature, for blood flow. Why? Because the biggest immediate threat is failure. A tiny blood clot, just one, in that newly connected artery or vein can cut off the blood supply and starve the flap of oxygen. If that's not caught and fixed immediately, the entire reconstruction could die.
So this slide really just lays it all out, right? It shows you the enormous stakes of this case. On one side, you have all these severe factors working against the patient. The advanced stage, the cancer invading bone and muscle, the spread to the lymph nodes. But on the other side, you have the incredibly ambitious goals of the treatment, to get clean margins, to restore the patient's ability to eat and speak, and to give him the best possible shot at a long-term cure.
So, after following this intense journey, what are the big takeaways for all of us? Well, first, the link between chewing tobacco, like gutka, and oral cancer is just undeniable. Second, and this is so important for everyone, if you have a sore or an ulcer in your mouth that doesn't heal within 2 weeks, you need to get it checked out, period. Third, be aware of signs like trismus, which is basically lockjaw. It can be a really ominous sign that a tumor is invading the jaw muscles. And finally, as we saw, beating advanced cancer is a team sport. It takes a village.
And that leaves us with one last, pretty sobering thought. We know the science. We've seen the incredible things modern medicine can do. This patient's journey was so difficult because the disease was found so late. So the real question isn't just for doctors, it's for all of us. If a simple 2-week ulcer is a key warning sign, how many are being missed right now? And what can we do to make sure the next person's story is a much shorter one?